Hello, this is Ruby Simmons, your medical billing mentor and owner of Blossom Revenue Cycle Solutions. Welcome to Teach Me Tuesday. And today I wanted to review FSA versus HSA. And this information is helpful for both patients and private practices who may not take a lot of insurance or take any insurance at all at all. So I wanted to review what do they do and basically what the difference is between an FHA, FSA and HSA. So basically, what they do is they both offer tax benefits, which means that the patients don't have to pay towards taxes when they save this money out of their checking account. And they both have annual contribution limits, which basically mean that they can only save a certain amount of money. They can't just save an unlimited amount of money. And a patient can't have both an HSA and an FSA through the same employer. They would have to do something like have that one spouse have an HSA and the other spouse have an FSA. And if I didn't explain this in the beginning, FSAs and HSAs are savings accounts that help patients to pay their balances after their health insurance. So their deductibles, their co-insurances, their non-covered services, their out-of-pockets, things like that. This is what FSAs and HSAs do for patients. So what's the difference between FSA and an HSA? A FSA, if you don't use the balance of your, or if you don't use your FSA at all, whatever you don't use, you lose it. So let's say you put away to save $1,500 for your FSA, but you only use 1,000, you're going to lose that 500. And it doesn't benefit people who don't need a lot, who don't have a lot of healthcare costs. So if you're a fairly healthy patient and you only go to the doctor when you got the sniffles or maybe a cold or something, and you don't pay most of the time, you don't have a deductible for your physicals and things like that. So this does not benefit you because you have to put down some money. And what if you pay less, you use less than what you decided to save, then you'll lose that money. So it wouldn't benefit someone who doesn't have a good amount of healthcare costs after the year is done. And it also has a list of coverable items. So you're limited as to what it will cover because it'll only cover things that are on the FSA list. Now, HSA is a little different because you have to have a high deductible plan to qualify for this. And what it also does is you don't lose this money, it'll roll over to the next year. So then you don't have to be afraid that if you don't use this money, that you lose it. So this would be a little better for people who don't have a lot of, even who have a high deductible plan but don't have a lot of times that they really go to the doctor very often. Let's say they go to the doctors for a sniffle or whatever money they've put aside would go to that. And then if they don't see the doctor again, that money rolls over. And it works for people, like I said, that don't have a lot of high costs because it rolls over. So that's the biggest benefit for the HSA. And you just, as a private practice, this would help you for patients, especially if you don't take their insurance plan, This is a question that you want to make sure you ask your patients. So let's say you have a patient and you don't take their health insurance, ask them, well, do you have an HSA? Or ask them if they have an FSA. If they have an FSA, they can still use the FSA towards paying for your service if you don't take their insurance. And make sure that you let your patients know that if you don't take their insurance, or if they don't have that kind of coverage on their insurance plan, that you could use their FSA or HSA to cover the services. And thank you so much for joining me today on Teach Me Tuesdays. And I really hope that this benefits you and gave you value. And again, my name is Ruby Simmons. I am your medical billing mentor, and I'm the owner of Blossom Revenue Cycle Solutions, where we feel that a provider should not have to juggle patient care in their revenue cycle. And have a great night, and see you next Tuesday. And don't forget, this Sunday we will be doing Let's Talk Medical Billing on Clubhouse, and I look forward to seeing you there. Have a good day.